So, artificial intelligence is transforming the mental health landscape. So, can you bring us into the light of what SRHIN is doing as an organization to ensure that mental health is getting better in Nigeria and beyond? So let's start from this side.
Okay. Personally, I wrote a manuscript centered on mental health, and I gathered my data using Twitter. And I realized that most posts were from organizations that advocate for mental health, not individual posting about their mental health issues. In collaboration and research departments, we performed one-on-one interviews with people that have mental health issues because most times they will not want to post about their mental health issues on social media because of the fear of being stigmatized. So after performing those interviews, we look for possible solutions to those problems.
That's
Yeah, so drawing from the work that collaboration and research does, we use the research they do to inform the project that we carry out in the communities they serve. For example, in IDP camps in Abuja, we realized that most of the people living there have lack basic access to mental health services. So we ideated and carried out a project to train community intermediaries, that is normal members of the community, their teachers, their fathers, mothers, those normal people. We train them to be able to offer therapeutic services to one another, bridging this gap in their community. And that's how community impact is transforming mental health in Nigeria.
so beyond clinicians, beyond professionals, we are empowering the random to ensure that
Yes,
we progress.
yes.
So let's move to creativity and innovations.
Yeah. You mentioned impact, right? So in creativity and innovation, we harness the power of AI-based technology, web-based technology. We use this to like amplify the impact beyond physical boundaries. For instance, let's say you know that there's this stigma around talking about mental health, like you mentioned. So let's say there's this AI chatbot where people can go to anonymously and chat with and get their information. Let's say there's this mobile app where you can like reach professional mental health like online and talk to them, share your problem and get your information. That would be much more easier. People can go there, like get their information, get help. Also, we have our website, which is our online office, like I used to say, where people can just go to view basic information. We have blogs that talk about mental health, and they can read through this and get help.
All right.
All right, so for communications and media, is like an indirect approach. You understand? We reach a wider audience through social media. For example, one of our posts reaching about 200K views. You understand? Which in number we may not be able to, reach that amount of people, but we use social media to, reach
And number of people.
greater number of people exactly.
All right. So I believe that with what we are doing in SRIN, from the research to the advocacy to technology, we are ensuring that mental health is getting better in Nigeria, in the underserved community, and even beyond our reach. So I think we can give kudos to Ms. Norman Writing for great work we've done, and for us to keep innovating and keep creating new ways of making our mental health. I think we are doing well. Can we give a round of applause?